Sheri, but good morning, everybody. Welcome to the February meeting of the South Jersey Men's Club. I believe it's maybe our 10th meeting since COVID, and going strong. We've got 36 participants this morning so far. Probably get a few latecomers coming in, so we're active and staying active, and hopefully everybody's well. And we've gotten 1 shot, 2 shots. Everybody's hopefully feeling well. That's my wish for everyone. And we have somebody to keep us well this morning. David Schwartz, would you like to introduce Sheri, or is she going to introduce herself?
I'll introduce her.
Okay. Go ahead, David.
Good morning, everyone. Good to see all those smiling faces out there. This morning, Sheri Tideman, that's Sheri with 1 R, is the Rehab Supervisor at Virtua Health, located at the JCC down by the gym. I have to admit that I've had rehab there a number of times, and they've been a wonderful help to me, most recently with an arthritis issue. But she's not here to advertise her company. She's here to tell you how to feel better. And Sheri, appreciate you coming. Thank you very much. Go to it.
Okay. So like David said, my name's Sheri. I'm a physical therapist. I've been working in outpatient physical therapy for about 6.5 years now. At the JCC, I've been, and I really enjoy what I do. I feel like it's very rewarding. I get to work with a lot of people and help people see them get better. I do have my doctorate degree, which I earned from St. Francis University. And I recently became LSVT Big certified, which is a treatment for individuals with Parkinson's disease, which I've been enjoying working with that. So today I'm going to talk about something that's, I think, very important. And it's like I paid you guys to have that conversation before we started, because I'm going to talk about staying active during a pandemic. I think it's so important because a lot of conversations came up, like you do feel apprehensive to go places, and you may not be as as active. I mean, even walking down the hall to the room where you guys used to have your meetings, that's a pretty far walk. So that even counts as some activity level, but you're not getting it. Now you're in your homes and not moving as much. So before we start, I just kind of want to take a quick survey, so you can kind of raise your hand. I want to see where we're at. How many people feel like since COVID, they've been less active than they were? So just give me a hand raise. Okay, let me just scroll through. There we're at. Pretty much almost everyone. Okay, how many people feel like they are more active? Anyone? Good job, Alan. Okay, good. We got a couple people. That's awesome. For me, I've actually had more time in my day. So that's got me back into exercising, which I'm happy about. How many people feel that they're the same activity level? They weren't really active before, and they're still not really active. Anyone? We got some. I appreciate the honesty. Okay, good. So hopefully with this presentation, if you're less active, it will give you some motivation and encouragement to improve your activity level, and ways to do that in your home. Or if you are exercising and active, that will just kind of keep you motivated to continue doing that. So physical activity and staying active is so important for your health. There's so many health benefits, and especially as you are aging. It can help you to reduce health risks. It can improve quality of life, decrease pain, and then it can help you stay active and independent for longer. Hopefully this guy doesn't look too familiar to everyone. This looks like a lot of us now kind of sitting the couch potato. We're sitting more and not being active. So some effects of an inactive lifestyle. So you can have weight gain. So you're not burning the calories like you would be, and you're eating more. And not only are we eating more, but we're eating more of those unhealthy snacks. And when being home, it's just like much easier to go to the fridge or go to the pantry and grab those. So with increased weight, you're putting more work on your body and more stress on your joints, especially the weight-bearing joints, so your hips, your knees, and your back. So with this more stress and added weight, it makes it a lot more difficult for you to perform your daily activities, and it can be painful. So then also with an inactive lifestyle, you're getting a loss of muscle mass and strength, your bones are weakening, and you're getting a decreased cardiovascular endurance. So muscles, bones, and the heart, they all need to be stressed in order to improve or maintain their ability to do work. So with loss of muscle mass and strength, if you're not using the muscles, they lose their function and their strength. So this may make it harder to do things like stand up out of a chair or lift a gallon of milk out of the fridge. Same thing goes for bone. In order to maintain bone strength, you need to add stress to the bone. This can be resistance type exercise or weight bearing type exercise. When your bones weaken, you become more frail, and then you're at risk for falls and fractures. In regards to cardiovascular endurance, the heart is also a muscle. So this needs to be stressed so that it can work well. You want the heart to be functioning at its highest potential so that you can have blood flow throughout your body. The less the heart has to work, the easier it is for it to do that. If you don't have good cardiovascular endurance, you might find something as like walking up the steps, you're short of breath, your heart's beating very fast, it's much harder to do. Or if you have to get from one place to another quickly, this is kind of causing you to be out of breath with a fast beating heart. So other things an inactive lifestyle can cause is a decreased immune system. So this is extremely important right now because we're all trying to stay healthy and prevent ourselves from being sick. And also if you get sick, you may find that you are more sick than you would be if you were active. So the reason why physical activity helps your immune system is that the blood flow helps the immune cells to protect you. It decreases your inflammation and stresses on the body, and it can help to protect against infection. You may feel low energy, you don't feel like doing anything, everything seems harder. A poor mood, so this could be related to when you're not active, you're not getting as much sleep, or you may feel agitated, depressed. When you're exercising, your body can help with serotonin, which can put you in a positive mood. It can promote sleep health, and these are all things that make you feel good. And then also an inactive lifestyle causes increased health risks. So that could be obesity, type 2 diabetes, heart diseases, stroke. Even if you have some of these things already, inactivity can kind of make these worse. So in turn, an inactive lifestyle can cause all these negative things, but an active lifestyle can promote weight loss, improve strength, improve muscle mass. You can strengthen your bones. You can have better cardiovascular endurance, better immune system, higher energy, being positive, and you're healthier overall. And it was a conversation that we were talking about before this, like how it's just isolating, you're not getting out, you're not socializing, you're just not yourself, and you're not in a good mood. So exercising and being physically active, even if it's in your home, can help your overall well-being and quality of life. recently, over this past year, I've been hearing so many people say a lot of these things. So now, in relation to aging and the musculoskeletal system, some things you might feel throughout your day, you might feel like you're weak, stiff, achy, slow, shrinking, a lot of people say. And you might feel that you're losing your balance more frequently. Some of these things are related to the normal age process. So in terms of weakness, it's normal to lose muscle mass as you age. So for men at the age of 60, there's a 4 to 6% decrease in muscle mass every decade. And for women, it starts at age 40. And like I said, the more vulnerable you are with inactivity. So this kind of goes with the saying, if you don't use it, you'll lose it. You may also feel stiff. This is due to a decrease in flexibility and elasticity of the muscles and tissues surrounding the joints. So you might feel that you don't have the same range of motion that you used to, like you can't reach like you did. You might not have the same hamstring flexibility. You feel very tight around your knees and your ankles, and you're not moving as well. So this is also more vulnerable with inactivity. This goes with the saying, motion is lotion. You might also feel achy in the joints. This is most commonly because of degenerative changes in the joint. You're losing that cushioning of the joint, and you get bones rubbing up on each other. You get that crepitus, which is the crunching feeling. And this is also kind of part of the age process. This goes with the saying, if you rest, you rust. You can feel slow and shrinking. So a lot of times people say that they feel like they are shrinking, or they're not as tall as they used to be. This is true, because the discs in your spine, they also lose that cushioning, and then your spine gets smaller, and in turn you're shorter. And then also with changes of the spine, you may feel like you used to be tall, but now you're starting to hunch over. And also loss of balance. So with that, weakness, stiffness, achy, and other age-related changes all can contribute to that. The more active you are, the better you are with your strength, your mobility, your coordination, your reaction time, and this can all decrease risk of falls. So even though some of these things are a normal part of the aging process, if you're active and you address them, you can alter or slow down these things from happening. Later in the presentation, I'll go over some different ways that you can address this. So inactivity and pain. There's a lot of chronic pain conditions like fibromyalgia, or if you just have a joint pain that's been for a long time, your body starts to sense this pain, even though the tissue may not be damaged. Your nerves have been hypersensitive and in a pain state for so long that it's telling your body that it's in pain. So this makes you not want to move, which I can understand because it hurts. However, movement helps your body to realize, okay, I can move in this way, it's safe for me, and it won't hurt me. Osteoarthritis. So I'm pretty sure a lot of people have osteoarthritis, and it's something that they deal with in various joints. When you're not active, you're not helping the osteoarthritis. I mean, you can't change that you have osteoarthritis, but what you can do for it is you can strengthen the muscles around the joint. That helps support the joint, and it takes the pressure off of the joint, which can help with pain. Moving the joint and working on flexibility can make sure that the joint gets that natural fluid going to it, which can help with the achiness and that crepitus crunching feeling. And then osteoporosis. So with inactivity, you are not helping yourself because that's weakening the bones. Again, you're not strengthening the tissues and the muscles that are surrounding the joints that have osteoporosis. So you're not giving them the support. And then commonly in the spine, you find osteoporosis. So if you're not working those postural muscles, you may find kind of hunching over more. And then tendinitis. So itis, whenever you see that on the end of the word, that means inflammation. So tendinitis is inflammation of the tendon. This occurs whenever the load that's being placed on the tendon is greater than the work the tendon can do. So commonly this comes when you're doing something repetitively over and over, and your body's just not used to that. Or if you haven't done something in a while and then you go to do it and your muscles are just not at the strength potential that it used to be. Another way you can get tendinitis is body mechanics. Sometimes if you're doing something wrong or you're putting the wrong stresses on the muscle on the tendon, that can cause inflammation and pain. And then low back and neck pain. It's extremely common, probably one of the most frequent things I see. And when you're not active, again, you're not using those muscles to support the spine. You're not working on your posture. We're all mostly sitting like this. So let me do a quick look at you all. How's your posture, everyone? Not bad, not bad. We got some slouching. I can see you. Okay. So posture is a very important thing. I mean, we all are sitting more. So let's talk about posture. So as we're going through this, I want everyone to try to correct their posture with me. When you're sitting, you want to maintain the natural curves of the spine. So you don't want to be slouched like this. Sitting actually is one of the activities that puts the most pressure on the spine and a lot of stresses on the ligaments and the supporting muscles of the spine. And when you're doing it for a long time, such as sitting, watching TV, or sitting, driving a long time, that can cause pain. It can also cause changes to the spine over time. This is one of those things, it doesn't happen right away, but over time, as we're doing it more and more, it ends up causing pain. So what you can do to fix this is you can use a lumbar roll, or you can just take a pillow, put it in the small of your back, and that will naturally bring you into a better posture alignment. It will correct the bottom, which in turn corrects the top. It's also better to sit on a firm surface if you can, when we're sitting in the recliners or on our sofas. It just is kind of promoting you to sit in more of a slouched, slumped position. You're sinking into the couch. So sitting on a firm surface is preferred over a soft surface. And then you really want to try not to sit for more than 30 minutes at a time. If you can, set a timer, get up, walk between your commercials, just to get moving. So there's other things you can do while you're sitting that promotes mobility and strength. So I want everyone to do these with me now. So sit up tall on the edge of your chair, whatever surface you're on. And you can do ankle pumps. So ankle pumps, you just want to move your feet toward you up and down very gently. And you can also do circles. So you can move your feet clockwise and counterclockwise. So go ahead. I can't really see your feet, but that's okay. But just do a couple of those. So doing this is really good for loosening up your ankle joints, help with stiffness, and then also it can get blood flow moving. So that's something very easy you can do if you're just sitting. Another thing you can do is for your knees, just straighten your leg out and then come back down. That will just get your quads firing and then loosen up your knee joints, especially after sitting for a long time. Okay, so the other thing, sitting, you're not using your glute muscles. A lot of people are very weak in their glute muscles. So when you're just sitting, you can just squeeze your butt cheeks together and that will get those muscles firing. Something very easy to do and no one really knows you're doing it. So it's good. It's good. Do it. It's good to hold it for like 5 to 10 seconds. And then if you can do 10 to 20 of them, that's good to get those glute muscles firing. And then when you go to stand up, they're active. So it's not like you've been sitting forever not doing anything. Another thing you can do is just sitting up has been shown to activate your core muscles even more than crunches. Now, I don't think it's going to get you a six-pack, but at least you're using those muscles to support your spine. And you find that sitting up tall, even though it seems awkward and not natural, you're really actually working hard to do it. So here's an example of poor posture and good posture. Now, I know that some people, if they have any spinal diagnosis, it might be hard or painful to sit like this. Just, you don't have to overcorrect. Don't force to where your body won't let you go. Just sit where you feel comfortable, but more upright. And then also you want to be in the 90-90 position. So you want your hips at 90 and your knees at 90 degrees with your feet flat. And then also don't forget about the neck position. Most of us, like, we're forward like this, we're on our computers, we're looking down on our phones. So our heads are like this, our shoulders are around it. You really want to get those shoulders back, squeezing them together, and a little chin tuck. So from the side, like you're trying to give yourself a little double chin. So it's important to incorporate stretching, strengthening, balance, and cardio into your physical activity. The CDC exercise recommendations are for the age of 18 to 64 years old, 150 minutes of moderate intensity activity. So this is just anything that's getting your heart rate up. It can be walking, it can be bike riding, elliptical, going up and down the stairs, anything like that. And then also 2 days of strengthening. And then for 65 years and older, the same recommendations, but they also recommend incorporating balance. Balance is something that you just have to practice over and over, and you'll see improvements. But then if you stop, you will lose that. Something to remember with exercising is that if you can't meet these requirements right away, it's okay. Or if you have a condition that's limiting you from doing it, that's also okay. Any little thing that you can do to improve your physical activity is great, and you'll see improvements with time. Listen to your body and do what you can. You don't want to overwork or try to do too much and end up injuring yourself. Another thing is physical activity and exercising doesn't have to be going to the gym. It doesn't have to be an hour at the gym. It can be spurts of activity throughout your day. Something to remember. All right. So now I want to get you moving. I want to do a little test. So if you want to participate, you can. If you have some reason why you can't do it, don't feel that you need to. This is a 30-second sit to stand test. So what you do is you have to stand up and sit down without using your hands. So this is something functional that everyone should be able to do, but many people can't for many reasons. So what this test looks at is how many you can do, and then if you are below average, it predicts risk for falls, and it also predicts lower extremity strength and endurance. All right, so I'm gonna time you for 30 seconds and count how many you can do. I'll say, is everyone ready? Ready? Put your thumbs up if you're ready. Good? All right. Ready, go. Stop. Okay. How'd you guys do? Bad? I see some thumbs up, some thumbs down. Okay.
How's 22 do?
22. Okay. Wow, that's off the charts. That's really good. That's above average for an 85 to 89-year-old, but you look more like 20, so definitely above average there. Good, that's awesome.
I did 23.
Wow, that's really good too. Anyone beat 23? All right.
Well,
I had 24.
24, Larry. All right. Wow.
my God.
I had a practice session before I did the real one. It helped.
I did 3.
3, we got 3. All right. So even if you can do it, that's a good start. But if you look at this chart, this is just the men's chart.
I did 12 actually.
You can see where you compare to the norm. And this is something that you can practice throughout your day. Whenever you get the chance to stand up from a chair, try not to depend on your hands. And you'll see improvement over time.
Hey, Sheri, can you hear me?
Yeah.
Yeah, what does this, what is the point of this? Does it help with balance? Is it?
So this is a predictor for falls. So if you are below the average, that means you're more at risk for falls.
Okay.
Yeah.
Yeah, I broke my ankle about 3 years ago. That was an interesting fall.
Yeah, and I'm sure that could contribute to if it was harder for you to do too.
Yeah, right.
Okay. Very good, guys. Thanks for
So
participating in that.
12.
All right, so now we're going to talk about some exercises. Now, these are just general exercises that should be safe for most people to do. However, I don't know everyone's past medical history, so use your judgment if you're going to try these. David sent you these in an email, all the exercises. So if you ever have any questions about them, you can always reach out to me. I'll give him my email that he can send to you if you have any questions. So like I said, if these cause pain, don't do it. That's not the intention of the exercises. So in the morning is a time when you could feel extremely stiff because you have not been moving. Your body likes movement. So it's good to start from the bottom and work your way up and just gently move each joint. So ankle pumps, we already talked about. You move your ankles up and down. Start with like 10 to 15 reps. Just do a little bit. Heel slides, you bend your knee up and back, loosen up those knees. You can do quad sets or those glute sets we talked about, just squeezing the front of your knees, trying to push your knee down into the bed. Glute sets, squeezing your glutes together. When you ever want to do hold, you can do like 5 or 10 seconds and do 10 to 20. The supine elbow press, you put your hands behind your head if you were laying down, and then you push your elbows into the pillow. This is good for, it's a good stretch for your chest, and then you're also kind of firing up the muscles in your back. The supine isometric, there's a picture where you have your elbows bent and you're pushing your elbows down into the bed. And then the clasp hand flexion, that's good for loosening up the shoulders. You kind of want to grab your hands and then move it up and down, nice and slow to get those joints moving. So I think you feel fine if you can give yourself a little bit of time just to move each joint before you get up. It will make your morning activities easier with less pain, and you'll feel a little smoother, more agile doing these things. So now we'll move on to stretches to stay limber. Whenever you do stretches, you want to hold them for a long time, for like 30 seconds to a minute. That really allows the muscle to lengthen. You want to be uncomfortable, but comfortable enough that you can sustain the position. And you want to make sure that your body is in the right position. You don't want to be forcing into the movement and causing stress on other parts of the body. You also don't want to go further than your body's letting you, because that can make you prone to injury. So I gave you a couple stretches for the large muscle groups of the body. So for the hamstring, you can either just put this down a little bit. You can sit on the edge of your chair and just put your legs straight out. One thing with the, I don't know if you can see me. No, that's not working. But yeah, sit on the edge of the chair with your legs straight out. One thing with the hamstring stretch that you want to be careful of is you don't want to reach as far as you can forward like that. You want to keep your body upright and move forward. You'll feel a much deeper stretch when you do that. Okay? And then for the calves, you can always grab a dog leash, a strap, a bath towel robe. You put it around your ankles. You would put it around your ankle and you pull towards you so that you're getting a calf stretch in the back of your leg. Okay. And then for the hip flexors, so stretching the front of your thighs here, you can stand in a lunge position with your legs back, and you'll feel a stretch in the front here. Now for the upper body, the chest and the shoulders, you can do a stretch in the doorway. So you put one arm on one side and one on the other, and you gently lean your body into the door. The only place where you should feel it is in your chest here. And then a good shoulder stretch is that you can try right now, bringing your arm across your body, holding it there, and then across the other way. That's a really good stretch for your shoulders. You should feel it in the back of the shoulder here. So strengthening, strengthening can be functional, or you can do upper body weights, you can do lower body. Sit to stand like we just did, that's a great weight bearing exercise, hits large muscle groups of the legs. Step ups, you can go up and down the steps, or you can walk all the way up and down a flight of steps. That will get you strength and cardio. Wall push-ups, I'll demonstrate those for you. Going up to a wall and then going towards the wall and back away from the wall. And then you can make that harder by stepping further away from the wall or increasing the incline. So trying to do it off of a bed or eventually moving onto the floor. You could do bicep curls, so you don't have to have weights. You can use what you have around your house. So I have some diced tomatoes and some beans. You could do bicep curls like that. You could do shoulder raises like this, out to the side. You could do tricep like that. Lots of different things that you can do with just kind of cans, or you can make bags of coins that can give you some resistance. If you do have weights or resistance bands, those are good to use too. And balance. So heel raises, it's good to go up and down on your toes. Romberg stance is standing with your feet together. Tandem stance is one foot in front of the other, and then single leg stance is standing on one leg. So some important things when you're practicing your balance, do it somewhere safe, whether it be in a corner or at a counter, so that you have something to grab onto if you do lose your balance. Don't perform balance in the shower. I don't know why. Lots of people tell me that they practice balance in the shower. Don't do that. That's dangerous. And you can incorporate balance throughout your day. So like if you're brushing your teeth, try doing it with your feet together and see how you do. Try standing on one leg. If you're making coffee in the morning and you're just waiting for it, do some balance. It's really good for you to do throughout the day. I would suggest to start with the feet together, and if then that's too easy, you can try it with your eyes closed or go on to the next balance exercise, one foot in front of the other. The hardest thing would be standing on one leg on a pillow with your eyes closed. Don't try that though. And then cardio. So like I had mentioned before, walking up and down the stairs, trying to do the sit to stands as fast as you can a couple times, walking between rooms. You can increase your endurance by starting a timer, see how long you can go and gradually increase that. Okay, so does anyone have any questions? Oh, questions. I don't know if I can. Ed, are you able to?
They're going to have to unmute themselves. They'll have to unmute themselves if they have a question.
Okay.
Now, hang on one second. Let me. Do you want to stop your screen sharing at this point?
Sure. Oh, there we go. I can see all now.
Okay, and we'll get a gallery view, and you can either raise your hand and wave, and you can unmute yourself. Don, you want to ask a question?
Yeah, Sheri, is there anybody we could hire to do all these exercises for us?
We wish, right? Good question.
So, Randy, go ahead.
Okay. Good morning, Sheri.
Good morning.
Just two questions. One is on the one slide that mentioned, what was it, 150 minutes of moderate exercise. That's not 150 minutes a day, is it?
No, sorry, that's a week.
Okay. Because I thought I remember hearing something about an average of 30 minutes a day to an hour.
Yep. So that would be
Okay.
30 minutes, 5 days a week, or you could even do less every day.
Okay. And the second question is that was a great slide. I'm calling it a slide presentation, but at any rate, it would be good if it would be possible for you to, even though you can't demonstrate everything on it, I think we have enough memory to remember what some of the physical exercises were, but it makes a great reminder chart. And I'm just wondering if you could make a PDF out of that, potentially send it off to David or Ed. And it would be great to keep just to stick up on the wall here.
Do you want the whole presentation?
I mean, if you
Or the
send the
exercises?
presentation, I can make a PDF out of it for everybody.
Okay.
I'm assuming it's a PowerPoint.
Yeah, it's PowerPoint. Mhm.
Okay, and I can work with that. That's not
Okay,
a problem.
perfect. Yeah, and then I think David emailed you everyone the exercises. Did you receive them?
No,
Yes,
Uh-oh.
no.
yes.
No and yes.
No,
So Sheri, I have a question for you. My health plan gives me silver sneakers, and I've been doing 45-minute exercises over the web with them, either live or recorded. And I wondered, is Virtua doing anything like that over the web?
That's all. So we don't have any group things as far as I know, but we are offering telehealth physical therapy if anyone's interested in that. So that can be, you can come for anything as far as like deconditioning, strengthening, anything like that. So you would have an evaluation with the physical therapist, which probably would be me, and then I would create a program for you and we can do that together. That's through your insurance.
I imagine that's more geared to specific problems that people have, setting up that type of a program with you.
Yes, but it also can be general too, like deconditioning, decreased strength, and stuff like that. You just need a prescription from a doctor.
Okay. Anyone else for
I
questions?
have a question.
Ed,
Sheri,
I don't know who's speaking, so tell me who's.
when?
okay. Sheri, what are your thoughts on those braces that you put over your shoulder and you pull the straps and it pulls you back? What are your thoughts on those?
I get that question a lot. My opinion is that I don't like it because I want you to do the work. I want you to use the muscles to hold it there.
Sheri?
Much of this is like chair yoga. I take chair yoga when I'm back at the gym. It's wonderful.
That's awesome.
Sheri?
Back to the gym.
Lee Yasger, go ahead, Lee. Unmute yourself, please.
I'm unmuted.
My question is there some type of book like the Andersons used to publish for dummies, for stretch and flex and exercises? People who wanted to run or jog used to buy that book, and it was very affordable.
I don't know, but I can look into that and see if I see one that would be good, and I can send that to David for a recommendation.
Right, it was like a 30-page manual for, people to keep stretched and flexed. And
Yeah, I don't know of anything like that, but I'm sure there is something. I just don't know.
Sheri?
Who else? Could you raise your hand before you start to speak? Don Kaplan, go ahead.
Hi, Don.
Hi, Sheri. Nice to see you.
You too, Don.
Sheri gave me therapy, I think, on 2 different events. And then you gave me homework.
Mm-hmm.
And I've been doing the homework on a daily basis.
Yeah, Don.
And the only upper body in there is the push-ups.
Okay.
And so I'm looking for recommendations on more upper body. And there's a balancing where I'm on hands and knees, and then I lift one leg in the opposite arm.
Oh yeah. Mm-hmm.
Yeah.
That's a good one.
But suggestions for upper body.
I would suggest like the wall push-ups. Bicep curls are good, and then the shoulder exercises ones. But if you want it more of an individualized program, I could try to give you something for that too.
No, just your suggestions are good.
Okay, yeah, so did you get the pictures of the exercises?
No.
My homework you gave me had
No.
illustrations. It wasn't photographs, but that worked fine. I mean,
Okay.
Yeah. Okay,
Marty?
thank you. Nice to see you.
You too.
Marty,
Thank you,
Ralph?
Sheri. Yeah, thank you, Sheri. Great presentation. Now, just a quick question for women. The metrics that you provided, are they the same for women or are they?
No, they're different.
Okay.
I can pull those up if you're interested.
Well, like you mentioned 150 minutes. So for women,
Oh,
would
those
that,
recommendations. Sorry,
okay,
I thought you were talking about the sit to stand. Yes, that's the same for women.
okay.
Please raise your hand. David Wynn?
Yes, Sheri. I have a lot of these pages from the Inquirer. They put out something every week about different exercises. What do you think about those exercises?
Ooh,
I don't know what they are.
I got it in front of me right now. Can you
Let
see
me
it?
see. Hold them up. Hold them up.
Going to be a little hard to see. David, I don't think we can see them.
I can't see him, David.
Okay.
But so if
Anyway,
they-
Sheri, thank you for the service you provided my wife.
Yes. Well, oh, you're welcome. Tell her I said hello. If the exercises are not causing you pain and you feel good doing them and you're safe, then I think they're good exercises, even though I can't see them.
Okay, anybody else?
yeah, can you hear me?
Yes, I
Yes,
can.
go ahead, Dick.
Okay. I just sent a chat note on it, but I get Arthritis Advisor because I guess a lot of us are suffering from various forms of arthritis.
Mm-hmm.
And I find that to be really helpful because it is geared. I think one of the problems, by the way, with the Philadelphia Inquirer, I've seen those exercises. It looks like the women are in their 20s and maybe the guys are in their early 30s. So it seems like it's out of proportion for what we do. You know, it seems like the very strenuous types of exercise, and we're looking for things that are relatively easy to do with repetition.
Yeah, that's a really good point because if you do have arthritis, you want to exercise, but you want to be doing the right thing because you
Right.
can do the wrong thing and flare it up and cause pain.
Right.
And everyone's different. I mean, so you have to make sure it's the right thing.
I like to walk. That seems to, I've got to a point where that really helps. Just
And walking's great.
yeah, puts a lot of good pressure on your joints, I guess.
So Phil Gutteroff put up a chat, which all of you should be able to see, and I agree with him 100%. There are so many videos on the web, they're free. I mean, I use Silver Sneakers only because my health plan happens to participate in it. And if you've checked out your health plan, they may participate in it. But a lot of those exercises, whether they're the live programs, which I do sometimes if my times permit and I'm available when they're doing the live programs, or the recorded programs, which are basically the live programs just recorded, are fantastic. They're usually 45 or 50 minutes, and I get a good workout. My wife uses 2 or 3 a day sometimes, and she loves them. And she's got some fibromyalgia, and it's helped her a lot with it. She says it's very comparable. She used to swim a lot at Virtua, and she's not able to do that now, but she says the live exercise programs give her a lot of the same effect as being in the water. So anybody else for questions? Raise your hand if you would. David Singer, good morning.
Good morning. Unfortunately, I missed the first 20 minutes or so because I had connection problems. But I didn't hear anything about adapting the exercises for someone who's been ill, particularly now with the pandemic. People that have COVID, so many people have what they call the long haul symptoms, things that just go on and on and on. And what are your recommendations on how to adapt? Is it something you have to talk to your physician about? Or?
Yeah, so that's not something that I addressed. However, like David said, I'm not trying to promote Virtua, but we are treating individuals who've had COVID to help improve their strength, endurance, and all that. That is definitely more of an individualized thing. So if that's something that you're interested in, you can always speak to your physician and then seek treatment from a physical therapist so you get the proper program for you. And so it's at the right level and then it's advanced at the right intensity.
There's actually a program at the University of Pennsylvania that's dealing only with people that have continuing issues.
Yeah, that's great.
Anyone else? Scott?
Go ahead.
I wanted to thank you, Sheri, and yes, I would like to.
We're having trouble hearing you. If you want to turn your sound up.
Is that better?
Yes, yes.
Okay. I would like to promote Virtua, and I would like to thank you, Sheri. I was there about 1.5 years ago. I am incredibly grateful. Could you repeat again, though? You said, and the doctor had given me a script, but we were waiting for COVID to be over. I don't think it's going to be over in the next few months.
No.
So you are open for tele-PT, correct?
Yes. Mm-hmm.
Thank you. That's
it. Thank you.
Sheri, tell us a little bit about what Telept is.
So we're doing telehealth treatments. So it would be basically like this. It's one-to-one with the therapist, and the assessment would be like you were in the office, and it's just not hands-on. But you still get great benefit from it because you're one-to-one with the therapist and you're being instructed on proper exercise that's right for you based on your need.
Okay, thank you. Anyone else? Hands up if you would, so I can see. Don, go ahead. Don Weisenstein.
Yeah. Sheri, you have to have a script or something to get the PT with you, or?
Yes, it can be from your family doctor.
Like I'm in Gloucester County, so I was wondering, is there anything more out this way than Camden County or?
Gloucester County, what, there's an office in Washington Township.
Yeah,
and is that near there?
That's not much better for me as far as getting to it, quite honestly.
So I can say this, if you're interested in the telehealth, it doesn't matter where you are. You just have to be in New Jersey, and I could do it.
Okay.
Because you don't have to come in.
Thank you.
Mm-hmm.
So, Sheri, just to clarify, if you do have a script from your doctor, you're not necessarily covered by your insurance, but you're asking that you come with a script so that the doctor lets you know what you're treating?
Correct. And Virtua requires a prescription because we are under a hospital-based system, but we accept most insurances, and then we let you know your coverage before you come in.
Okay, thank you. Anyone else? Abe Furtis.
Sheri, for the few lucky of us that are already fully vaccinated, I'm getting very, very mixed signals. So what can I do? I feel like I'm ready to get out of there, get out. So, what is the professional experience on that?
I know. I feel like a lot of people have been saying that and kind of just waiting for the CDC to recommend what we can do. I personally know as much as you know, I think unfortunately we don't know. I know that they're saying you are much safer with the vaccine. And then of course, in a healthcare office, you have your mask on, everyone's saying socially distant and stuff like that. I know for our office, we're limiting the amount of people we see. So we can only see one person every half hour. So most people feel comfortable, but yeah, sorry, I can't really give an answer for that.
Thanks. Anyone else? Hands, please.
Yeah, I desperately need a haircut.
Yeah, me too.
Larry Bernstein, go ahead.
Look like crap.
Hi. Hi, Sheri. You mentioned swimming, and I am a swimmer, but I kind of do my own thing. And I was wondering if you or Virtua had any specific guidelines on what amount of swimming, any specifics about that kind of exercise.
Yeah, so I would say you could relate that to the CDC recommendations. Swimming definitely considered moderate intensity activity. So I would try to, if that's what you like to do, I would try to meet those recommendations with your swimming.
Well, I do other things too. I just was wondering if there was any specifics about swimming itself, or just part of the just incorporated along with the other whatever else I do on land to meet that 150 minutes a week.
Exactly. And then the 2 days of strengthening. That's great.
Thanks.
Thank you. Lee, go ahead.
I have a question about taking in a new patient in telemed with a prescription, because as I read the insurance coverage guidelines under, well, for most of us, it would be CMS, some form of Medicare. You have to already be a patient at the to get a service on telemed. You can't be brand new. That's the current guidelines for insurance coverage. So I'm just wondering how it secures that the individual isn't being charged by the healthcare system for telemed if they haven't previously been a patient. Because it's a pretty nasty surprise charge to find out about.
Yeah, so as far as I know, I haven't seen that. Is that new or?
So the stipulation under insurance coverage approvals through CMS, Health and Human Services, is no new patients on telemed are covered. They have to be existing. That's specific for insurance coverage, not for becoming a patient, but just for insurance coverage.
Yeah, I haven't been told that by like my managers and everyone doing the telehealth, but that's something.
Virtua doesn't care. They'll get the money.
No, that's not true. That's not true.
They'll bill.
That's not true. I would not do that to someone. Yeah, so that would be something I would have to look into. Obviously, you wouldn't want someone getting that big bill like that.
Yeah.
So,
sign me up, Terry.
So I have a question, Lee. Are you saying that if you haven't been treated by a specific provider previously, you cannot start with them using telemed? Is that what you're saying?
So, Virtua is a big system and it has a lot of divisions. And so if you have a physician like David, who's already a Virtua physician, or me, I'm a Virtua affiliate who writes a prescription, they consider you a patient of the system. But if your doctor's not, or you have a nurse practitioner who's not part of the system by affiliation or by employment, then you would have to be considered new. And it's your insurance company's payment desk that's going to make that discrimination, not any one practitioner who makes that discrimination. So you could have a valid prescription and go to a valid provider, but your relationship with that provider and their system being brand new may prevent your insurance system from covering that according to the rules that Medicare put out when this whole telemed began. And they modified it. Used to be, it had to be with video. Now it doesn't have to always be with video. But that phrase about no new visits still remains in the regulations. So that has to, again, the provider, they wouldn't even know about it. It would really be the insurance company.
Yeah, that's definitely something I have to look into, because I haven't heard that, and we haven't had anyone mention that or complain about that. So that's definitely something that needs to be checked.
Yeah. Yeah, because the insurance
if I could just put a
authorize
extension here, Ed.
And a year later, demand compensation back from the patient.
Okay, Robert, go ahead.
I recently got notification from Aetna, and they're promoting telemed, and they're promoting it without any restrictions as to what doctors you would see. And my understanding is that if your supplemental on your Medicare is PPO where you're don't have to worry about networks in or out, it should cover it.
I agree. I haven't had any issues with seeing new patients with telemedicine. No issues, Lee. So I think you may be mistaken.
Well, that's great. No issue.
Okay.
Sounds like be cautious.
Yeah, something to keep in mind, but just so it's clear, the intention wouldn't be to still treat and then have someone have a huge bill at the end. That would not be the intention.
Anyone else with a question? I'm going to go to the other screen. I don't see any hands. You do see Jim Rosenthal.
Morning.
Go ahead.
You mentioned a balance exercise with your eyes closed, which makes it much harder.
Yes.
Is that actually good practice, or it sounds to me it's more dangerous or more likely to topple over?
Yeah, that's not something I would suggest doing on your own if you have balance deficits, just because obviously that does make it harder. But that's something that if you're with someone and you need to further challenge your balance because you're not being challenged enough, then that's something you can do, but definitely a last option.
Larry Clee, go ahead. You have to unmute yourself. Larry? No, we still can't hear you, Larry. You have to unmute.
Alert from updates available.
Larry? We cannot hear you. If you unmute yourself, just jump in and we'll know that we can hear you, and I'll recognize you a little bit later. Anyone else? No hands at this point. If you do have something, I don't see anyone. So Sheri, I wanted to thank you. It was very informative. Obviously, you've got a lot of interest from the population this morning. We had over 40 attendees. You know, I know you've joined us live once before. Maybe when we go live again, you can come visit us and we can do some exercises after the lox and bagel. You can come and join us for some lox and bagel.
Thanks.
We all need that exercise after the lox and bagel. We have some pretty good eaters here, so. But in any case, we're kind of hoping that one of these days it's going to open up again. Who knows? Maybe my wife says I'm always too optimistic. I'm hoping it's June, but maybe it'll be August or September. Who knows?
Yeah.
But again, thank you very much. Very useful information. Thank you.
Well, thank you so much for having me. I appreciate all the questions and feedback, and I thought it was great. If you guys need anything, I really am there to help.
Thanks again. If everyone will stay on for just a minute, I really don't have any pressing business. I want to let everyone know who previously signed up for the Israeli tour, the Western Wall tour. You've gotten an email, I believe, that we're going to have it in April. I believe it's the 25th. If you haven't signed up before for that tour, we will send it out again in case you want to join. We do have some room for some more people. For those of you who have joined, you're all set. We'll keep you posted as we get closer. We're still almost 2 months away. April 25th, I believe, is the date. Other than that, we have a meeting scheduled. Dave Schwartz, Trusty Dave, has got another meeting for us. I don't know how he does it, but he does. And we have another meeting coming up at the end of March. And I believe it's a emeritus art professor. Am I correct, David? From Rutgers,
Yes.
who's very well known in the area. Unfortunately, not by me. I'm not an artsy kind of person, but I'm sure it will be interesting. I understand he's a very interesting person. So join us next month also. Anyone else while I'm on, if you have some general business, Sheri, you're welcome to stay with us, or you can come, you can go off if you'd like to.
All right, thanks guys, see ya.
Thank you, Sheri.
Thank
Go
you.
enjoy
Bye.
your Sunday. Yeah.
If you have something, either raise your hand or unmute yourself and talk to
Eddie,
us. David, go ahead.
Eddie,
Yes.
for the tour at the end of April, for those who wrote out a little prayer that the tour guide was going to put in the Western Wall, they need to do it again.
Right, I'm gonna,
Send
I'm
in
gonna,
there a little
I'm
prayer.
gonna give you, I'm gonna give everyone, once we get closer, I'm going to give everyone the instructions again on where those messages have to go and so
Fine.
forth. So at this point, just kind of sit back and you'll be hearing from us. But as David stated, they want us to do the messages over again so that they're in one place and current. So we will let you know about that. And for those of you who might not have joined the last time, be patient. We'll send out an email in the next few weeks asking you if you'd like to join us on that tour. I think we had 30-some people who are signed up and ready to go, have paid. It's a $10 fee. And then we're asking if you would to donate something to the food bank. Anyone else?
We have an investment club meeting, I guess. Did you mention that?
No, I did not. Is there an investment club meeting after this, Dick?
Should be, yeah.
Are you doing, you're doing your own Zoom on that, or are you staying on this Zoom?
No, good
Art
question.
has his own Zoom. So.
Okay, you're doing your own Zoom. So if you're in the investment club, you should have gotten a Zoom. If not, I guess you can contact Dick or Art or Bob Greenberg and get your Zoom codes from them. They can send them to you if you've lost them. Other than that, I wish everyone a good day, a good week. Robert, go ahead.
By the way, David, for some reason, I'd never received the exercises. If you sent them out,
I didn't send them out. I got them. I have them. We'll have them sent out to the membership.
Oh, okay. All right, I thought they were sent out, but that's
what she said. Did I get them? And the answer is yes. I'll get them out to the membership.
Well, that's good.
Okay.
Appreciate it.
Thank you, Bobby.
All right, everyone. Have a nice day, a nice week. Keep getting your shots. I got my second shot a week ago, Thursday. I was at a commission the next day, just kind of lethargic, I'll say, but got up the next morning after that. I was fine, and I feel great. I hope everybody gets the same reaction or no reaction. My wife got no reaction. My daughter got no reaction on the second shot. Moderna.
I got exactly the same reaction. We took it the same day also.
Right.
Yeah, so it was just like a little dizziness, a little hot flashes, but nothing else. And then the next
hot flashes, gee.
I'm getting my first in about an hour and a half.
All right.
Good luck.
Sounds good.
I had no reaction at all to the second shot 2.5 weeks ago.
Really?
But my wife did. So it's real individual.
Right.
So if someone has been scheduled way out and you're in the 65 or 75 age group, I sent out an email about a week ago. Sounds like everybody's in good shape. I had no response. I have a woman who can be helpful in moving up an appointment, but not to next week necessarily. But if you're scheduled out April or May, let me know. Actually, I have to thank Len Berman. I don't know if he's still on with us right now. I don't see him, but he might be. Lenny, are you here? Lenny? No? Okay. Anyway, he was the one who put me onto this lady who works with Cooper and was very helpful to someone that I know in getting a shot at Blackwood. And that's all I have. Anybody else? If not, we'll call it a day and go about our business.
Can I add
Sure.
something before we leave?
I don't know who's talking, but go ahead.
Yeah.
Oui.
So if anybody feels sick at any time, there's nothing wrong with going for COVID testing. If you're positive and you're just a little bit sick, if you have a Virtua affiliated doctor like David Nydorf, you could get a prescription faxed over to infectious diseases department. That department will call you up and screen you and will definitely make an appointment for you to get the monoclonal antibody intravenous infusion. They've done it for a couple patients of mine. These patients have been completely well within 24 hours of getting that infusion. And Virtua has been really right up to the minute on taking patients referred by their doctors.
Yeah, my wife had the monoclonal antibodies at Virtua, and she caught it almost, I guess, the first day. And it was, Gloria, you?
Okay, I had a little trouble. I had a little trouble at nights, the first 2 nights, but other than that, I never had any symptoms. And that's what's funny about this disease. When I went into the hospital, Scott thought I had a heart attack. I had never had a symptom for COVID, but the hospital screens you for COVID when you come in. And it turned out that I was positive for COVID. I'm very grateful to a cardiologist at Virtua that I don't even know the name of, which is embarrassing. This all happened a month ago. We haven't seen bills or anything because he said, get out of the hospital. They had me in a room. He said, get out of the hospital so you're eligible for the infusion. So I went in on a Friday morning, went out on a Friday afternoon. Scott picked me up at about, I guess I went in at 6 in the morning. We left at about 5:30 in the afternoon. And the next day I had the infusion. I had, as I said, 2 nights of chills and nothing worse than what people are saying for their shots. And then perfectly fine, other than I had to be in quarantine for 14 days.
I wouldn't worry about getting billed because this whole program is really funded separately. So some of my patients had the infusion going back to the first week they started the infusion program, and there's really been no balance billing. Insurance either covers it or doesn't. But they
I wasn't worried about that as much as the thank you.
But this is really a pandemic approach to caring for people in the community. I mean, hats off to the Virtua team for putting that together, you know, and they're really
handled it well.
All right, everybody, thank you. And again, have a nice day and hope your week is good, David. See you.
Good meeting.
Thank you.
All right,
Take care,
thanks,
everybody.
everybody.
Stay well, guys.
Bye, Don.
Thank you.
Happy
Excellent.
end of forum.